Welcome to the Simplified Dentistry Podcast. Join us as we discuss clinical, operational, and financial aspects of your practice, help you enjoy life, and dare to simplify dentistry.
We'd like to thank our sponsor, Comet USA. Comet equips the people behind every beautiful smile. They provide thoughtfully innovative and high-performance instruments you can trust to deliver care you're proud of and results your patients will never forget. Comet burrs are the only burrs that I use in my office. Learn more and shop online at cometusa.com. Hey, welcome back to the Simplified Dentistry Podcast. I'm Dr. Mustafa Shah-Khan, and we are fortunate to have Dr. Meena Barsoum on with us today. We had Dr. Barsoum on several weeks ago, but unfortunately, little delay in us recording and getting the podcast out. And Dr. Barsoum is now the global head of clinical strategy for SprintRay. When I grow up, I want to be the global head of something.
I know it's a fancy title without a lot of responsibility. So we'll see where it goes.
Yeah, well, thank you for joining us again, Meena. And for some of our listeners, kind of touch on let's touch on SprintRay, what SprintRay is, and let's kind of get from there.
Yeah, no. So I'm excited to be part of this organization. SprintRay has actually been around for 10 years, just celebrated their 10-year anniversary just a few months ago. And, what we're kind of focusing on today is bringing 3D printing to the masses. Our goal at SprintRay is to make sure that our patients for our practices are getting, quality restorations that are attainable to any practice that has any scanner. So that's really what got me super excited about this opportunity, is seeing what the company was building behind the scenes and getting a little insight to that. And it really helped me make this decision to join the organization. Yeah. So when you say bringing, high quality printing, 3D printing to the masses, kind of what's kind of the driver? How do you do that? How do you accomplish that? Yeah. It's so when I was at Chicago Midwinter this year, just a few months ago, I had the opportunity to actually attend Midwinter as an attendee this year, which was first time I've had that opportunity to do in a long time without being, tied to a responsibility. So I was walking around the show floor and I got to see the team over at SprintRay, and they introduced me to the Midas printer. So if you haven't heard of the Midas, it's a very small printer. It's about this big. And what that printer does, it's a digital press. So it's meant to print single units and individual restorations directly in a very small, compact unit. Now, the beauty of that product is we can bring in different resin profiles. We're building different resins for higher strength, higher toughness, higher surface toughness. But you can now print in about 8 minutes a single crown, a couple of inlays or onlays, and you can put 3 different capsules in the printer and print them at the same time. So I can go either one single crown in 8 minutes or 6 crowns in 8 minutes. Because the technology behind printing is it's printing one layer at a time. So it doesn't matter how many units are on it. So it's really created an opportunity to make, direct restorations like inlays and onlays a possibility. And obviously full coverage crowns and veneers. But when I say bring it to the masses, you don't need to have a specific scanner or a specific software to be able to use the SprintRay ecosystem. It's any scanner on the market that can export an STL. And we have our own cloud design software that allows us to design these single units right in the cloud. So there's no expensive software to buy or licensing or anything like that. So when I say masses, that's what I mean. 51% of the market right now has an intraoral scanner. A very small percentage of those are actually milling or manufacturing in the office. The rest of them are just an opportunity to be able to bring chairside manufacturing to those practices.
If I got a Midas, I have an iTero for my Invisalign stuff. I can just print off of that, design them.
Yeah, and exactly. iTero is actually a great partner for this, because iTero, they are now including the iTero Design Suite as part of your online access. So iTero Design Suite, for those who don't know, it's a basically ExoCAD, but in a very light version. So it's meant for single units, quadrants, bridges, splints, and things like that in models. So with that software, you're able to design anything that you scan on your iTero, and you can take that design and drag it right into the SprintRay Rayware Cloud software. You bring the STL of your design in, it automatically positions it on the build platform, and it sends it to the Midas to print. So it's all done automatically in the background. But you can use your iTero, you can use your PrimeScan to upload scans and design them. So it's really completely scanner agnostic.
You typically have to have some type of design software. Obviously, SprintRay doesn't have design software on their own, do that. Yeah.
We do, yeah, and that's what really got me excited. Is there's a we call it Studio AI, so it's still in beta, but it's essentially AI designed for single units for crowns, inlays, onlays, and veneers are coming. So what does that mean? I can bring the scan in, so it's an STL of an upper jaw and a lower jaw, and I just drag it right into the Studio software, and I walk away. And in a couple minutes, it automatically identifies which tooth needs the restoration, what kind of restoration it is. It automatically marginates and it gives you an initial proposal. And then from there, you have simple tools like a morph tool and a smooth and an add tool to customize the design if you want. And when you're done, you click a button and it goes right into the printing software, all in the cloud. So right on a web browser, there's no software needed. Right now, it's only for single units, but our AI team is building the quadrant software as we speak. So maybe by the time this launches, we'll have the quadrant software, who knows, but that's definitely something that is being worked on in the background. So you don't need to buy expensive software if you don't want.
So with when you say it's printed, you and I grew up in the world where everybody would ask us if the CEREC was printing, and we're like, no, it's a milling unit, and you get superior strength with milling versus printing because you're only as strong as the weakest layer. Is that a misnomer, or how would you approach something else?
The way I look at it today, is the Midas replacing milling? No, I don't think so. I think it's a great complement to the chairside milling solution. For those practices that have chairside milling, adding a Midas is a complement because it allows you to now work on quadrants more efficiently. What does that mean? Do you love doing direct composites? Putting a matrix band in and a wedge and a ring and all that stuff and doing direct composites. It's, in my opinion, in dentistry, it's probably one of the biggest issues we have currently is direct composites not lasting as long as, let's say an amalgam would have lasted in the mouth. So we're getting recurrent decay. We're using these bulk fill materials that maybe are being misused and not curing fully. And, so those direct resins that are not enjoyable for us as dentists to do, they don't last as long in the mouth. I look at that as being a great opportunity for, hey, let's bring in a Midas and let's add this indirect restoration option for a high strength material that has a 60% ceramic component in it. And instead of trying to mill that restoration, and as you know, milling is a great solution, but for tiny little restorations, it's not always feasible because you have to deal with the tool size and the angles of the tools. And sometimes you get over milling and you may not get the smoothest surface there because the tools are a certain size. The sprue ends up on a contact almost always. And now we compare that to a printing solution where now I can put the supports on the occlusal. I have a lot more detail in anatomy because it's an additive process and I can do a full quadrant in 8 minutes versus, 4 or 5 individual blocks that I'm milling out. Now you have a solution that you can bring in and replace all those direct resins with indirect dentistry, which, as we know, is going to be a better fit. It's going to last longer. It's polymerized before it goes in the mouth. So all the benefits of indirect dentistry. And then certainly as a dentist, you can charge a little bit more for that because it's a better material. It's a ceramic material versus a composite. So that to me is the big win for this. And how do I couple that with CEREC? I still use my CEREC every day. I still mill my zirconia crowns every day. But as I see the materials coming and, there's new materials coming out later this year that are going to be 70% filled with ceramic with better surface toughness and better wear resistance. And that's just today. Imagine 2-3 years from now, as our biomaterials innovations keep improving, we're going to have the zirconia replacement as a printable solution, and it's going to be in the Midas, and it's going to be available for anyone with a scanner.
Sure. It's interesting you say that. I remember going to a CEREC doctor's, CDOCS, whatever it was, way back when, and one of the speakers was Pascal Magnac. And Pascal talked about, he thought Lava Ultimate was the greatest material ever. That's the only thing he used. He used CEREC every day and he used Lava Ultimate. But he talked about how you delivered it is you would take that indirect restoration and you would heat composite and you would force it into place and you would bond with a microfill composite. I believe there's a microfill composite.
Yeah.
And it was because the microfill composite would fill that space. What are you doing to put in printed restorations that are trying to replace the direct composite?
So when you think about the milled restorations, there was over milling. There was going to be gaps in there that he was trying to fill with that microfill composite. But with a printed restoration, there is no over milling. It's a true representation of the intaglio surface and of the fit. So we're bonding them in. We're bonding them in with a resin cement. So we use Verilink Aesthetic as our resin cement, just like you would for a glass ceramic. Now, the difference is this material doesn't need hydrofluoric acid etch. It doesn't need the handling that, let's say, an Emax would need. You sandblast it, you try it in, use a cleaning product like Katana Cleaner or IvoClean, and then you bond it in. So we use a full bonded protocol, and once it's bonded in, it's in. It's part of the tooth at this point. And now we're getting into that whole biomimetic philosophy of putting materials in that mimic the flexural strength and the way that a natural tooth flexes and moves and wears. Are these printed materials right now? It's not harder than the enamel. It's not harder than the opposing dentition. It's going to wear evenly with the adjacent teeth and the opposing dentition. And that's the idea of that whole biomimetic philosophy.
What do you think about it? I mean, I've had several of these in the last few weeks where it's a quadrant of MOD, DO, DOMO composites, and nobody wants to do that.
Yeah, that's why we have associates, right? We kick those down.
Yeah, that's what I need is an associate.
Yeah.
But yeah, you also have that, and then you also, I don't care how weak you are, I think I'm a pretty good clinician, but you go back at some point in time and you're like, God, that just was a little bit of an overhang here. Not even an overhang, but yeah, there's a lip on here, there's this, there's that, I mean, it could be better, I guess, but how do you finish this in the same manner? I think this is a great solution. And does it take you any more time? Like if you were to allocate a quadrant of composite versus a quadrant of this, what would you do your time?
Here's how I'll position, and I'll tell you, like I said, I think this is endemic in dentistry where these direct composites aren't lasting as long as they should. And I look at my schedule, and our software codes fillings in a blue color. So if I see blue, I call it the blue screen of death. I'm angry. I don't want to see those patients because they're direct fillings, and it's not ideal. And nothing is more humbling than putting these wedges in and getting a contact and then pulling the band out, and now it's open, or you have beautiful marginal ridges, then you have them bite down and you got to grind it all away, and now it looks terrible. So those are things that I don't enjoy. So when we look at time for this, there's two amounts of time that we have to factor in. My time individually is the dentist, and then the actual chair time. So it's actually less time for me as the dentist because I prep scan and I walk away. And the next time I'm back, I'm bonding them in. And I try to bond them in all at the same time, so I don't have to deal with, anything binding or, one contact getting too heavy or too light. So I put in all the restorations, we bond them in at the same time, clean up the excess, and then they're on their way. So it may take a little bit longer because now instead of putting in the direct composites and moving one tooth to the next, it's going to take me 8 minutes to print, another 10 minutes to post-process it. So is that worth it for me? In my opinion, yes, because I could be in another operatory doing something else, or I could go do my hygiene exams, or I can be more productive somewhere else. So to me, it's the cost benefit of, yes, you're adding about 20 minutes to the appointment, but you're getting a better restoration that you can charge more for because it's a premium restoration, and you're doing good dentistry. And I don't have to worry about looking at those x-rays, like you said, in 6 months and, hating myself and wanting to hang up the handpiece. And what we do as dentists, we just look at our dentistry and we own it. Like we make it like it's our fault. And at the end of the day, still the patient's tooth. We do the best we can in a wet, dark environment.
Yeah, absolutely. Kind of in your practice now, what's the scanner of choice? You have your Prime scan, you have your your PS2 or whatever it is. What do you pick up?
Yeah, it's a good question because I'm fortunate. I have multiple scanners. I have a Prime Scan on the cart. I have a Prime Scan laptop. I have Prime Scan 2, and I have the new iTero Lumina. So we have a lot of scanners. Our iTero lives on the hygiene side, but I've started stealing it a little bit restoratively because it does scan really nicely, and I like having that direct entry into exocad where I can design the case right away. But primarily, I'm still using my Prime Scan 2. I'm scanning everything in Prime Scan 2. I'm exporting the case to exocad, which is my design software of choice today. And then I design it in exocad because that comes right from DS-Core. So it's built in right into the workflow. I design the case in exocad, and then it's my choice where I manufacture it. I can send it to my Prime mill, or I can send it to my SprintRay products and my Midas. So that gives me total freedom and flexibility to use any manufacturing device I want.
Sure. So you're a new doc coming out. What's your setup? I mean, you have some money, but not a ton. So let's say you're talking about the 5-year doc. What are you going to do?
This is a heavy question, and the reason I say that is it really depends on what you see yourself doing. Because we make investments today with the goal of building something for tomorrow, and that's the beauty we have today in digital technology. When I got into CEREC, it was you got to buy a full system. There is no like buy a scanner and then figure it out. There was no printing. There was no real DI. Whereas today you have a big opportunity with digital impressioning, and honestly, pick your scanner. I think the Trios is an excellent platform for scanning. That new Shining Elite scanner, that aerial scan, is like super nice. It's very tiny and it scans really well. Prime Scan 2 is certainly a great option if you're getting into scanning, or Nitero. So I think you're a new doctor, you're getting into this, you want to just scan only, find the ecosystem that makes the most sense for you. Whether you like the Align solution or whether you want to just be totally free and open, or if you like DS Core, buy the Prime Scan 2. Those are great options. I think from there, then you have to decide what you want to make next. And if I'm a new doctor with limited funds, I'm looking at SprintRay very heavily, because with SprintRay, you can not only manufacture your indirect restorations, but you can throw in a full service printer that can now let you make your retainers and your night guards and models and surgical guides and all on X arches and all the different, manufacturing endpoints that you can get from a full solution. So for me as a new doctor, I'm going to look at that, because that's a significant cost savings in terms of entry point, but you're still getting premium outputs from it.
And SprintRay, do you guys sell direct, or is it still through a distributor?
It's both. I mean, we primarily sell through our dealer partners, because they, have relationships with the doctors. They can provide support just like we do. But all of the dealers carry the SprintRay portfolio, and we also sell directly as well.
Yeah. Kind of something I like to talk about is materials. We all try to figure out what are the best materials, what's the greatest material. Zirconia is the material of choice right now. Full coverage single units. What's your material of choice right now, and why?
Full coverage single units today, I have milling. I'm still milling zirconia. Katana 1 Speed is my go-to from a milling perspective. I'm bringing it in, and I'm milling that in 5 minutes. I'm sintering it in 9 minutes, and I'm delivering it. Now the reason I do that is because I have equipment that allows me to do it. I have 2 prime mills, and we can manufacture that pretty quickly. Now, when we start thinking about toughness and strength, we just have to be careful comparing 3D printed resin materials that have a ceramic component to a milled glass ceramic. Because a glass ceramic, it's a matrix that the crystalline structure can still crack, and those cracks can propagate. We have to treat it a certain way. So those materials need a lot more fracture toughness so that they can handle those crack propagations and how it's going to fail if it does fail in the mouth. But when you look at a 3D printed material, it's a resin base, and cracks don't propagate in a resin base. So it's treated differently. So it's not like these materials break in the mouth. They tend to wear in the mouth. So what we've seen in the past, some of the previous generation of these materials, they just wear a little bit quicker than we want. The newer materials have a much more wear resistance, and they're able to tolerate that amount of function and load in the mouth, as we've seen kind of in vitro. Now, we're testing this obviously in the mouth, and we're doing some long-term studies to validate that. But what I'm seeing today is these printed materials function a lot like enamel, and that is a good thing for me. If enamel is going to wear, I want the materials to wear with it. But I'm still, kind of linked to what I've been doing for 15 years and what's worked. But I'm not I'm not opposed to trying the new materials, and I am doing them more for premolars forward. My anterior aesthetic cases, I'm printing those now. So it's changed a little bit of how I practice, but it's a number 2 on a Bruxer, I'm still putting a zirconia in, and I think that's okay.
So there was I'm going to ask you a couple questions, but one, when you talk about glass ceramics having cracks that propagate, the big thing they talked about with zirconia is the fractures are supposed to be self-curing. Is that not correct?
To an extent. I mean, I think, self-curing on a zirconia, I mean, you're sintering the material, but if you come in and adjust it aggressively without cooling and you overheat it, it's going to crack. And if you under-prepare and you leave it thin, I mean, still 0.6 of a millimeter is still very thin, but if you're at 0.5 or 0.4, it could crack. And I've seen zirconia fracture, and I've seen them break, and it's not an immune product that can survive any environment. I think all those glass ceramics can break. Now, can you see a printed material break? I'm sure, but you're more likely going to see it wear down or potentially debond if it wasn't bonded in properly versus a crack.
And do you feel like the advances in printed materials there's more advances in the resin ceramics than the glass ceramics, or what are you saying?
It's hard for me to say because I don't know what a lot of the manufacturer are doing behind the scenes with the glass ceramics. What I can tell you, my role now involves me dealing and kind of coordinating with the universities and a lot of our clinical studies and our lab studies. And what I see is every university is clamoring to get their hands on our materials because they want to test it. So there's a lot of excitement behind it because it's it's a sexy new material and they want to be the first to put out a study and validate it or prove that it's not going to work. I mean, everybody wants to get their opinion on it. And I think to me that says something. It says that the market wants something like this, and we're hoping that that it's going to work. And I've seen a lot of the preliminary data, and it's going to work. I feel really confident about that. I wouldn't be here if I didn't.
So with the printed materials and with zirconia, has Emax, is that out of the repertoire now for you?
No, Emacs is still an option. This question actually came up earlier today. I was doing a panel with some of the Patterson folks here at their national sales meeting, and they were asking me about my veneer and anterior choice selection for patients. And I tell them I can do a no prep veneer where I'm not going to remove any tooth structure, remove very little tooth structure. But for me to do that, I have to print the material because it has to be very thin and it has to have the aesthetics. So I give them that option. And I say, these materials have been out for 4 or 5 years. There's not a lot of clinical data on it. So I feel confident it's going to survive, but you'd be, kind of going down that road with us. And if something were to happen, obviously we'd stand behind it. And then I give them option 2. I say, we can go with a glass ceramic like EMAC. That's my primary glass ceramic. Much more longevity. We got 15 years of data showing that it's going to survive. I have tons of cases where I know it's going to survive, but I have to prepare your tooth more, meaning I have to shave a little bit more tooth structure to get the thickness I need for it. And then I let the patient decide. And from there, they let me know which option they want. There's no price difference in either one. But I'm much more comfortable at this stage in my career to do these no prep restorations because if something happens, I know I can repair or I can stand behind it and I can replace it for the patient and just reprint something else if I needed to. And let's say these survive 7 or 10 years. In 7 or 10 years, we're going to have better printed materials. And I didn't take away their enamel and their tooth structure today where I wouldn't be able to replace it again in the future. So that's kind of my mindset today with how I'm handling this.
Yeah. So it's kind of the conservative philosophy. And if you do have failure, ultimately you have kind of left yourself in a position where you can make a new restoration and it's not so detrimental. You're not taking tooth structure away. You're not having
Exactly.
So I think that.
Exactly.
Yeah. Well, what else was I going to ask you? What really kind of took you away from the CDOCS world? I mean, obviously you were in the CDOCS world for a long time. Just the opportunity here, or are you wanting to advance another type of technology? Yeah.
As you know, I've been a diehard supporter of Dentsply Sirona my whole career. 15 years of dental practice. It's all I've used. It's all I've known. I'm still a believer in the workflows there. I just, the 3D printing world to me was moving at such a fast pace that I felt like, the printer that I had prior to this just wasn't meeting some of the needs and expectations that I had. So I actually purchased the SprintRay Pro 2 like last year before I even, took this role because it was giving me an opportunity to do more things with printing in the practice, speed, efficiency, indications. I do a lot of all-on-X dentistry and I'm able to print a full arch, within 20 minutes. And I can deliver that the day of surgery and no one else can give me that option. So that was kind of my primary move. And, when I met with the leadership at SprintRay, I was able to, kind of see a little bit behind the curtain in terms of what's coming. And I felt excited again. I felt like this was, I hate to put it this way, but the Sirona of the late 2000s, where they were just the constant leader and the innovator and bringing in new indications and workflows. And SprintRay reminded me of that. And it got me excited to, have this opportunity to come in and, be involved in a company that is taking the world by storm and really, taking over digital dentistry. And it got me excited. So, the CDOCS thing, it was a little unfortunate for me. I mean, I never intended to just leave like this. There's courses I teach there that I'm the only one that teaches. And my plan with the leadership there was always to remain through the end of the year and continue teaching those courses. And, CDOCS and Dentsply Sirona are, very codependent on each other. And I think there was a little concern on the CDOCS side with me being involved with a competitor that I could impact the relationship with Dentsply Sirona. So I just wasn't welcome back, basically. And it was a little sad to hear, but, I put 12 years of my life in there, and, all of the weekends and hours of travel and teaching and educating. And, it was nice to hear from old students kind of thanking me for what I taught them. And, but, we all move on, and everybody's got different priorities and needs. And now my focus is on SprintRay. And, maybe I can go back and partner with Spear on something in the future. But, unfortunately, CDOCS is now in my history. So we're moving on.
And I'm sure it was a great time. And we all know that that was very impactful for all of us. I took some of your courses, and it was great. Yeah, I'm looking forward to seeing kind of what the SprintRay aspect has, because frankly, I never really looked at it until you took the role, and now everything I'm hearing now really kind of it motivates me. I mean, it excites me about things that I can do to enhance my practice, enhance my patient experience, and deliver the dentistry that we all want to do.
My first trip to LA last month, after I started with the company, I was able to see our training facility in LA, SprintRay University. And as an educator, you're used to kind of certain things in terms of a lab setup with equipment and laptops and screens. And I was just salivating at what they had there. I was like, oh my gosh, this is going to be amazing. So part of my dream there is to build SprintRay University to be the premier CAD/CAM education in the world. You want to learn, what scanner do you have? We have a program for you to teach you how to use software, how to manufacture, how to deliver same-day dentistry. And that's my goal there. And we're going to work with our current partners like Wally Renee at the Mod Institute. They are phenomenal when it comes to understanding 3D printing and these manufacturing protocols. We're aligned with T-Bone and 3D Dentists in terms of creating education there. So we have partners that already have systems in there, and we want to just get every dentist to know exactly where to go and learn this stuff. And that's my goal.
So, when you get to where you have to build a East Coast operation, and you get tired of listening to T-Bone, you can probably avoid a slightly used CAD/CAM dentist like me. Yeah.
All right, we're in. Yeah. You are first on the list. I love it. You're just not as controversial as T-Bone.
That's right.
So we'll have to see what happens.
That's right. I can get more controversial if you need me to.
Okay. All right. Good.
Well, kind of what we asked you the last time is, kind of what would you do to simplify dentistry? And obviously, with what you're doing, I think there is aspects that are simplified dentistry. Tell me, kind of, how would you summarize that today?
Simplifying dentistry to me is finding what is the most complex procedure that we do that can have the greatest impact for a patient, and how can we perform that procedure in a predictable way where somebody with 20 years of experience and somebody with 1 year of experience can deliver a similar outcome. And to me, when I look at 3D printing as that option, that really does that for me, because if I can prep for an inlay, and if somebody right out of school can prep for an inlay, all of the variables have been taken away, because now I'm not having to pack a matrix band in and layer composite and cure it a certain way and avoid the C factor and think about all the variables that come into play with that. And I can just design it and print it. So to me, that's the key, is being able to create a procedural outcome or a restoration that anyone at any stage in their career can generate with a very similar kind of quality level. Same thing goes for surgery. I mean, we do all of our implant surgeries are fully guided, and at SprintRay we have a design service that can take an intraoral scan of a full arch of implants, an all-on-X procedure, and we can generate a prosthetic for you direct to the multi-unit abutments and right to your printer. And in 25 minutes, you have that prosthetic and you can deliver it. That's simplifying dentistry. That to me is way better than putting in temp cylinders and doing a denture conversion with acrylic and the block out with the rubber dam material and carving it down and being covered in acrylic dust. Like, this is simplifying dentistry, is being able to click a button and generate a precise prosthetic for a full arch patient.
Yeah. Absolutely. Well, thank you again for your time. I know you're all over the place now with the new role. Like I said, I might just call myself the global head of Simplified Dentistry, just so I can be the global.
That's it. Done. Simplified dentistry strategy.
That's right. Well, thank you again. We look forward to connecting with you again in the future, and having you on the Simplified Dentistry Podcast.
Appreciate it. Thanks a lot, Mustafa.
Thank you.